started. So thank you guys for joining. Happy Thursday. Um, Today I'm going to be covering immigrant access to health coverage under the ACA. So in this training, we're going to kind of dissect some common topics of confusion or misunderstanding when agents are assisting consumers enrolling in the marketplace. So we will be covering topics like, are immigrants eligible for marketplace coverage, CHIP or Medicaid? We're going to be reviewing some eligibility criteria for these types of coverage programs, as well as some special rules that apply to non-citizens and a few other items. This training will be recorded today, so for those of you that did RSVP, I can email the recording out to you after the training. If you did not RSVP and maybe someone sent you the link, if you want to drop your email in the chat or send it directly to me in the chat, I will ensure that you do get this recording to you after the training. A couple of housekeeping items before we get started. I ask that everyone remain muted throughout the presentation. If there are any questions, please use the chat feature and I will be able to address those throughout the presentation. We will also have a few minutes at the end of the presentation for kind of a Q&A session if you guys have specific questions or specific scenarios that you want to go over. But maybe if you're not comfortable asking the questions out loud, you can always reach out to me directly. I'll have my contact information on the next page. So before we get started, I would just like to introduce myself to those of you who might not know me. My name is Monet Garcia, and I'm the Marketplace Sales Director at Keystone Advisors. I'm based here in Houston, Texas. I'm not sure where everyone is dialing in from today. And my background includes several years of selling ACA and Medicare insurance. I'm also licensed in several states, and I'm quite familiar with kind of some of the issues that agents may face when they are enrolling clients in marketplace plans, whether that be on the federally facilitated marketplace or maybe on a state-based exchange. I have experience selling on some of the state-based platforms like California, New Mexico, Washington, Maryland, and a few others, because we know that the program eligibility is different in some of these state-based marketplaces. You can always feel free to ask me those questions. Before transitioning into this role, I was the corporate trainer and compliance specialist for Keystone Advisors. So I have that in my background as well. So if you guys have any questions, I have listed my email here on the slide for you, and you can feel free to use me as a resource throughout the year. Alrighty, so let's get started. Again, we're going to be covering the following topics today. So throughout the presentation, I will be referencing quite a few acronyms. So if you're not familiar with the acronyms I'm talking about, please drop it in the chat and let me know, because maybe someone else might not be familiar as well. But let's go ahead and get started, okay? So before we get into it, I just want to review some background on immigrant eligibility for coverage. So under the ACA, most lawfully present immigrants are eligible for some type of affordable coverage. However, the eligibility requirements will vary on a state-to-state basis. I think lots of us are familiar, that some states have expanded Medicaid, some do not have the Medicaid expansion, as well as when immigrants are applying, it is going to be on a state-to-state basis. Some states, give people access to more items without meeting certain requirements. And today, I'm specifically going to be highlighting the requirements and eligibility in Texas. So if you maybe sell in a state outside of Texas and you have questions, feel free to reach out to me after the presentation, and I can kind of deep dive into that. And if you're not sure, and if I'm not sure, then I'll usually research it so that I can become familiar and be able to answer those questions in the future. So Texas does cover lawfully present immigrants. Children who are under the age of 19, they will allow them to be eligible for Medicaid and CHIP. And if those of you who aren't familiar with what CHIP is, CHIP is a Children's Health Insurance Program. At least that's what it's called in Texas. This is going to be kind of a form of Medicaid for those whose family make a little bit over the eligibility income for Medicaid. So they're going to be lower income, but they're making a little too much to qualify for the full Medicaid program. So those children will be enrolled in the CHIP program. Okay, but just note that Texas does not cover most children that are over the age of 19, even though they are qualified immigrants into Medicaid. This also includes pregnant women. And later on in the presentation, we're going to be highlighting pregnant women who are non-citizens, what their eligibility is for these types of programs. Um, Across the board, most undocumented residents at any age are going to be excluded from Medicaid CHIP and the marketplace eligibility. Even if they want to purchase the marketplace at full cost, if they are undocumented, they will not be eligible for the marketplace whatsoever. This is the same for the Medicaid and CHIP programs. Additionally, the Affordable Care Act requires that lawfully present immigrants are excluded from Medicaid because of their non-citizenship status. And I think a lot of us are familiar with that, that most of the time we know that if someone is not a citizen, they usually will not be eligible for Medicaid or CHIP or any type of, government subsidies like those two programs. However, there are some exceptions, and we're going to be talking about a couple of those further along in the presentation. So now we're going to cover the ACA Marketplace special rule for lawfully present immigrants. So actually, there is a special rule specifically for immigrants because they are not generally eligible for Medicaid. And actually, this is the primary reason I wanted to do this training today because I learned that there are lots of agents that are missing out on opportunities to assist people who have legal immigration status because they aren't familiar that they are actually eligible for the marketplace, even with no income. So let's kind of break that down a little bit. So the premium tax credit that is offered on the health insurance marketplace, it usually requires that people have a minimum income or they meet the minimum income threshold to be eligible for the premium tax credit or the subsidy, also known as like extra savings. So there's a few different terms that people use to talk about the tax credit. So as a general rule, most people, whether when they're applying for the marketplace program, they have to meet that minimum income threshold, depending on their household size. Okay. And that's going to be known as the federal poverty level. So, the federal poverty level, this is a measure of income used to decide participants' eligibility for certain coverage programs like Marketplace, Medicaid, and CHIP. So, throughout this presentation, I'm probably going to be referencing the federal poverty level or FPL. So just note that that is a measure of income used to decide their eligibility in these types of programs. So when it comes to immigrants who do have a qualified immigration status, as long as they have not met the 5-year bar, and a 5-year bar, what that means is that they have lived here for 5 years in America. Um, but for those people that do have lawfully present immigration status and have not met that 5-year bar, they actually do not have to have any income. They can have zero income for the year and still be eligible for the premium tax credit on the marketplace, as well as other savings like cost share reduction. However, if they want to get Medicaid or CHIP coverage, many non-qualified immigrants, such as green card holders, people who have work permits, they have a 5-year waiting period. So if someone who comes into the country, they want to see how can I get eligible or how can I become eligible for Medicaid or CHIP, usually they have to meet that 5-year bar, and then they're kind of subject to the same rules as a U.S. citizen. So just keep that in mind. It is important to understand when did someone come to America, when did they start receiving their documents, and then that's when that 5-year bar will start. So pretty much to summarize this page, because I did kind of just talk a lot about some information that you might be confused on. When it comes to someone who has a qualified immigration status, so whether that be a green card, work permit, acceptable visa, there's so many different types of immigration statuses, which I have the full list in a couple of slides. These people can apply for a marketplace plan, they can receive the tax credit, and they can claim as little as $0 a month. They can be between $0 and that 100% of the federal poverty level and still get marketplace savings or tax credit due to the fact that they are not eligible to Medicaid. So before I continue, I have a couple of questions in the chat box. Let me go ahead and just look at those. Okay, great. They were just questions about the recording, which, yes, I will be sending it to y'all after the presentation. So I know I mentioned, qualified non-citizen or lawfully present immigrants. So this is going to be the full list of people who are considered lawfully present immigrants for the purpose of applying for insurance on the marketplace. Okay, so anyone with a green card, asylees, refugees, there's specific countries who have sometimes a short period of time that they will be eligible to apply for marketplace or Medicaid or CHIP and things like that. But this is going to be the full list that is actually provided on healthcare.gov. So if you are familiar with selling ACA plans, you know that healthcare.gov, that's the primary website that people go to for resources. Healthcare.gov, they do a lot of commercials, they do a lot of ads on Facebook and things like that to kind of tell people to go to this website. You'll find information on affordable coverage. And that's kind of the main platform that a lot of people know the marketplace by, healthcare.gov. Um, so if you have any questions about some of these rules or about resources on who is eligible for marketplace coverage, that website is a very good resource to use. It's kind of like our dictionary for, ACA brokers. There is another list of people who are considered lawfully present immigrants that would be eligible to apply for marketplace coverage. Um, One thing I want to highlight on here is that, okay, TPS, this is a form of a work permit. A lot of people are not familiar with that. Um, and then deferred action. So hopefully you guys have heard about DACA or are familiar with the DACA program. Um, DACA stands for the Deferred Action of Childhood Arrivals, and this is going to be an immigration status. It's temporary and it's something that I think it goes up to, the government to pass it and extend it for the people that have DACA. It's like every couple of years, they vote on do they want to extend DACA or do they want to, stop allowing people to keep living here. But just to give you an idea of DACA, most of the people who have DACA, okay, this is actually going to be for children who were brought here illegally, right? Um, so the government gave them a temporary access to stay here. So they don't have a permanent work permit. They don't have a green card. They have DACA. And so pretty much I know there's not a lot of paths for them to become citizens. Besides, if they marry a citizen, that's going to be the easiest path for them to become citizens. So, one thing about DACA, this is the one immigration status that will not be eligible to apply for marketplace coverage. Okay. Besides undocumented people, people who have DACA is they're going to be the other category of people that will not be eligible for a marketplace plan. So if you're not sure if someone has DACA, or maybe if your client or your prospect isn't sure if they have DACA, you can ask them to kind of show you maybe their paperwork or their documents. It might be a letter that tells them that they have, this temporary status to stay here under DACA. But if you have questions about that, you can always ask me, and we have some resources that we can share with you to kind of identify if someone is within that category. So next, let's talk about Medicaid and CHIP for lawfully present children. So under the ACA, most lawfully present children will be eligible for some type of affordable coverage. Till this day, lawfully present children under the age of 19, they will be eligible for actually Medicaid and CHIP if they have that proof of their immigration status. However, if they do apply for these programs, sometimes they're incorrectly identified or denied for these programs. So it is important to just understand that if they are a child under 19 and they do have, lawful immigration status, maybe it's not expired, they have the document, they should be able to apply for Medicaid or CHIP and potentially, be accepted into those programs. However, we are still seeing cases where these children are being denied, and it might just be maybe the paperwork that was sent in wasn't sent in correctly, just little kind of like administrative errors. So we do have a resource named Every Texan. They are actually a program. They do lots of things for immigrants and, making sure that people have access to different types of programs. They work specifically in Texas, but I think they have resources outside of Texas as well. But if you do have a case where a child that does have a credible immigration status and they were denied Medicaid or CHIP, you can actually reach out to Every Texan, and they will they have contacts in the Health and Human Services Department. They might be able to do something to kind of help that child actually be accepted into the program, because they are supposed to be accepted. It's just we're seeing that there are lots of denials coming through. And it's just going to be things like maybe paperwork wasn't submitted properly, and the parents are frustrated. They don't know how the program works. So that's kind of why this training is important for agents today, because you need to understand that these children are eligible for that Medicaid. There might just be something wrong in the system, so it's important that they try to reapply. They don't get frustrated with the program. And if you need extra assistance, you can reach out to a resource like Every Texas. In this presentation, I can go ahead. I have the link to Every Texan, but what I'll do is I'll actually send it to y'all in the chat so you can kind of research them while I'm talking if you'd like. Okay, so now that we've kind of talked about, a lot of information about, immigrants being eligible for marketplace coverage, Medicaid or CHIP, I wanted to do a couple of practice scenarios to just ensure that you guys are understanding and are on the same page as me. And these are kind of some of the scenarios I get on a daily basis. I get a lot of questions from brokers asking, these people have a certain document, would they be eligible for marketplace? Maybe they don't have any income right now because they just came in, but they do have a work permit. So, usually the answer is yes, the agent just didn't know. And there also are specific ways that you have to process the marketplace application to ensure that these people are getting the tax credit on the application. So today, I'm not going to be showing you an application because I don't have an application to show you, and there's not really like a dummy application I can do on healthcare.gov. But if you ever do have a question of submitting an application for someone that's not a citizen and they have immigration status, you can always give me a call. If you're in Houston, you can come to the office and I can help you run that application properly so that the family or the person that you're applying for does get the tax credit. Because there are actually specific questions you have to select properly, or else it's going to say that they're not eligible for anything. So, what I can do, okay, what I will do, I have a couple of practice scenarios. If someone gets, there's two of them. So whoever answers, I would guess first, that's right. I'm going to send you a little e-gift card, and it might be like a little Starbucks card or maybe a little Amazon card, but I can email that to you, okay? So just to make sure that you guys are paying attention today, whoever answers this first question right, whoever's the first one to answer this right in the chat, I will send you guys a little, I'll email you a little gift card for either coffee or Amazon or something like that. Okay, so this first scenario, Yasmin and Aiden and their two children live in San Antonio. They have lived in America for only 2 years, so they are immigrants. Aiden is an LPR. So an LPR stands for legal permanent resident, which is also known as a green card. So Aiden has a green card. Yasmin and the two children have approved visas and have applied to adjust their status to a green card. Okay, so let's break it down. There's a family of four. Aiden has a green card, and Yasmin, the wife, and the two kids have visas, but they are applying for their green card. Okay, their family income is at 85% of the federal poverty level. So let's just say their income is at 23,600 for the year. What are their coverage options for the family? Okay, so I'm not going to read it again. I'll let you guys read it really quickly if you'd like. But what I'd like you to do is drop your answers in the chat. What do you think the parents and the children or the whole family are eligible for? Would they be eligible to apply on the marketplace and maybe receive tax credit? Or would they be eligible for Medicaid or CHIP? What do you guys think? Feel free to drop it in the chat. We'll give it a couple of minutes before we go over the answers. Alrighty, I have quite a few answers in the chat, so thank you guys for participating. Um, Let me go ahead and look at some of these answers really quickly. And I also want to mention, if you're on this training today and you're kind of confused about where I'm at, this is not a basic ACA training. If you are needing kind of a basic ACA training, this is more of like a level 2 or 3 training. You would need to understand just like the generic eligibility requirements for people based on their income level and household size to kind of answer some of these questions, as well as understand kind of like what their income needs to be eligible for these types of programs. So if you're kind of lost right now, let me know and I can definitely set up, a more basic training for you so that we can get you on the same page as everyone else today. But let's go ahead and look at some of these answers. Okay, so I see some people say parents, no, kids, Medicare. Okay, Aiden only will get the coverage. The children are potentially eligible for Medicaid, and the adults can potentially qualify for ACA. Okay, Medicaid with CHIP, ACA for dad and mom, kids CHIP. Okay, so there's quite a few answers. It looks like some people have different answers, but for the most part, it looks like some of you guys did answer this correctly. Okay, great. So let's go through the correct answer. Alrighty, so we mentioned on the last page, right? Aiden and the mom, okay, they have immigration status. They have qualified immigration status. Even though Aiden has a green card and the mom has a visa, um, it's both qualified immigration status, okay? They could get marketplace coverage. Now let's look at the kids. The kids also have qualified immigration status, and because the family's income is low, it's below 100% of the FPL. It's at 85% of the FPL. The kids can be on Medicaid, okay? The family's income is not high enough for them to be on CHIP. And actually, if the whole family wanted to apply for a marketplace plan and you go to the quote page is going to tell you, due to this income, actually, the quote page with them wouldn't read it right because they're immigrants. But once we get to the end of the application, the eligibility results would say these kids might be eligible for Medicaid. So what you would have to do is if you're the agent processing this application for the family of 4, the parents, they would be eligible for the marketplace coverage, and with their income, they could get the tax credit. Okay. At the end, it would probably say these kids might be eligible for Medicaid, and what it's going to do is require you to send that application to Medicaid. So we get to go a little further into this scenario, we have sometimes families and they don't want their kids to get on Medicaid because maybe they've had a bad experience with Medicaid. Even though they're immigrants and they have low income, we have some people sometimes that are like, I know that my kids might not get the best care with Medicaid. How can I get them over to the marketplace? So in this situation, I would tell them that if they are eligible for Medicaid, the kids have to go to Medicaid. They will not be eligible for the marketplace with subsidy, if you don't want them on that program. The only way to not make them eligible for the program is to increase the parents' income on the application, um, or for the kids to just be denied. And the kids might be denied because maybe the Health and Human Services incorrectly identified them as it's denied for Medicaid. So, for those of you who answered that question right, let me see who answered it first correctly before we move forward. Good job. Let me see. Aiden will only get coverage. The children are potentially eligible for Medicaid and the adults. Okay, so Megan, I'm not sure what your last name is. Megan, if you can send me your email directly, I will send you a gift card because you answered the question correctly first. So good job, guys. Alrighty, we have a second scenario, and this one's going to be a little easier. It's just two people, very easy scenario. So practice scenario 2. Miguel and Carla are married and live in Austin, Texas. Okay, they are immigrants. Miguel is getting an MBA and has an F1 student visa. Carla is a US citizen. So, sorry, Miguel and Carla are married. Only Miguel is an immigrant. Carla is a US citizen. Okay. Neither has an employer offer of coverage. Okay, that is important to note. And their family's income is at 85% of the FPL. So they're below the 100% of the FPL. What are their coverage options? So go ahead and drop your answers in the chat. If you have questions about this scenario, you can also drop that in the chat. But again, whoever answers this first is going to get a little gift card emailed to them. So please, I'll let you guys think about this for a couple of minutes and then we'll look at the answers. Alrighty, so this one's actually a little easy, but I think a couple of people are a little mixed up. So let's go ahead and look at some of these answers. Alrighty, so let's review it again. Miguel and Carla are married, living in Austin. Miguel is an immigrant. He has an F1 student visa. Carla is a US citizen, and they're below the minimum threshold. Uh, they're below the 100% of the FPL. So what are their coverage options? So the correct answer is going to be Miguel is eligible for marketplace coverage and Carla is going to be in the coverage gap. Okay, so let's see if anyone answered that correctly, and then we can kind of review why it is the way that it is. Why is this the actual correct answer? Um, mm, mm, mm. Okay, so I'm gonna take actually Yolis, I'm gonna take her answer as correct. It says right here, Miguel ACA only. You didn't mention Carla, but that's technically right. So Miguel would be the only one eligible for ACA. I see a couple of people put that they could maybe get, they could both be eligible for ACA, and then I see one that they might be eligible for Medicaid. Um, Let me see. Megan also got the answer right again. So good job to those of you that got that right. But Yolis is actually the winner this time. So Yolis, if you can send me your email directly, I will make sure you get that gift card later. So let's go ahead and talk about why this scenario ended up the way that it is. Okay. So Miguel is eligible for the marketplace coverage because he is an immigrant below the minimum income threshold. He's not eligible for Medicaid as an adult, right? Especially in Texas, there's no Medicaid expansion for adults. So unless he was disabled, he's not eligible for Medicaid whatsoever. So he is eligible for the marketplace, and with that income level, he could get the tax credit. So he could get a very affordable plan. Okay, now let's look at Carla. Even though they're married and they're using the same household income, Carla is not eligible for the marketplace with any tax credit. And the reason being is because she falls into the coverage gap. So the coverage gap, for those who are not familiar, this only occurs in the states that do not implement Medicaid expansion. So Texas, if you guys live in Texas, we know that Medicaid does not have expansion for everyone. Sorry, sorry, that didn't sound right. Medicaid is not, going to be for everyone low income. The only people in Texas that will be eligible for Medicaid are going to be, low income families with children. Sometimes the Medicaid is expanded to the parents. Um, Seniors can get Medicaid in Texas if they have low income, and then people that are disabled. So if they're truly getting, disability income or they're truly disabled, they can also be eligible for Medicaid. Besides that, regular adults are not eligible for Medicaid. Even if they have no income, if they are US citizens, they are in what's called the coverage gap. So this is a very common issue or common scenario that happens in Texas. And a lot of the time, if I was Carla and Miguel's agent, Carla might be mad or Miguel might be mad and say, how am I eligible, but Carla isn't? And so you have to kind of explain why it is to the client. Um, and they still might not even understand why Carla isn't eligible. So for those of you that are following along, for 2024, do you guys know what is the minimum income they would have to have as a family for both of them to be eligible for marketplace coverage? Does anyone know what the number is or the dollar amount that they would have to have for 2024 for both of them to be eligible for a marketplace plan? And this is actually the minimum income you could list on the application for them to be eligible. Okay, I see a couple people put some things in here. Okay, great. So I see a few answers, and the correct answer is going to be about, yeah, 19,800 is right. It's the exact number is 19,720. So if their income combined was 19,720, and that's the income we put on the application, Carla would also be eligible to enroll in that plan and they would get tax credit. Okay, so the way that some of us know this is because there is some, the federal poverty level, we have a chart that you can look at and you can easily pre-qualify someone before even going through the mess of doing their application and finding out that one of them isn't eligible for the marketplace, that one of them is in the coverage gap. So there is something that's called the federal poverty level chart, and I have a copy of the one that we use at Keystone that I can send to y'all. Let me see if I can show you what it looks like really quick. So this is a copy of the federal poverty level chart that we use here at Keystone. We use it in our call center, and then I also share it to the brokers. So this is something that I can send to y'all. And what it does is it breaks down kind of the eligibility into three different sections. So I will send this to you guys. Everyone that RSVP'd, I'll send you the recording, and I'll also include the federal poverty level chart because this is a great thing to just keep on you. Because if you're helping someone apply, you get to the end of the application and you see that they're not eligible for tax credit. Sometimes you can raise that income just a little bit, a few $100s, and it will give them that tax credit. Because at the end of the year, it really just has to be, within a few $100s of what they're actually going to file, and they will not be penalized on their taxes. Okay, so I can definitely send this out to y'all if you guys are interested in receiving this after the training. So Ashok asked a really good question in the chat. He said, what if they have a requisite income initially and later they lose it? So usually, the general rule is that if someone, at the beginning of the year, they estimate they're going to make a specific amount, we will use that amount. And then what I usually say is, okay, if there's a life change, maybe you lose your job, or maybe your job fires you, or you get laid off, or maybe you get into a car accident, you can no longer work for the rest of the year. They need to call the agent and update that income on the application. Um, if that means that they are going to, maybe Carla will get kicked off of the plan, that's just what's going to happen. But you do, as an agent, you really need to be, asking your clients if there's any major income changes throughout the year, they need to update their application mid-year. It's not going to create an SEP or anything, but it's important because at the end of the year, if you didn't update their income, they might owe money back to the IRS for the tax credit that they received. So we don't want anyone to have any tax issues. So it's very important to let them know, to keep you updated on, income changes throughout the year. And then thank you, Megan, for sending out the FPL chart. Um, And Senya had a good question as well. So for those that are in the coverage gap, what do I tell them? Should I recommend them the gold card if they are in Harris? Okay, so that's a really good question. So for those people that are in the coverage gap, um, yes, we wanna, if you know of like a county assistance program, because several counties, really large counties, they have things called like indigent health programs for people that live in those counties that have very low income that might not qualify for Medicaid. So if you live in a county that has a program like that, I would definitely recommend something like that to them. There's several hospital systems throughout Texas that have those types of programs, and the one that Senya mentioned in the chat is Harris County. It's like the biggest county in Texas. They have a really good program for people that that are low income. They can apply for it, and they can apply on a yearly basis. Even undocumented people can actually apply for these indigent programs, and they will get access to go to that hospital system, not for free, but it's going to be sponsored from other places. But yes, Senia, in Houston, especially if you have someone that's in the coverage gap, you could recommend to them to apply for the gold card or for the Harris Financial Assistance Program. They can get on that, and that's going to give them, some temporary access to go to the doctor. They can get prescriptions with that. It also covers things like surgeries and stuff, but that's only in Houston that's able to help people. If someone is outside of Houston, they don't really have many options. So unfortunately, if someone isn't, eligible for an indigent program like that, and they're not eligible for Medicaid, they're in that coverage gap. Usually we tell them, there's really not many solutions for you. Um, if they have the funds or the means to pay for like an off exchange plan, or if they're able to pay for that plan full price, or maybe you get them on a short-term plan, that's another option. But I know most people can't afford those options. So usually, you just have to tell them they're in the coverage gap. Um, and if your income ever goes above a certain point, feel free to call me and I can assist you with this plan. But, not many options or solutions for those people, unfortunately. Okay, so let's go ahead and move on. I definitely wanted to stay within the hour, so I don't take any more of y'all's time. But thank you guys for participating. I'll be sending out those gift cards to those who won. So next, let's talk about some enhanced federal subsidies that are continuing, kind of post-pandemic. So in 2021, there was the American Rescue Plan Act that was passed by President Biden. This gave funding to a lot of different programs to kind of extend assistance due to the COVID emergency, because a lot of people lost their jobs or they weren't working, and things like that. Everyone needed extra help. So still now we see that there's a big boost in subsidy, and this is going to continue through 2025 under the Inflation Reduction Act. So what this means is that people will receive increased subsidies if they're under 400% of the federal poverty level. So we knew that in 2021, when the American Rescue Plan Act was passed, people were receiving extra subsidies, and then it also expanded subsidies to people above 400% of the federal poverty level, which before they weren't receiving any type of assistance. But sometimes now you'll see that if someone is at a higher income, they're over 400% of the FPL, you will still see them getting a little bit of tax credit. Um, that's kind of what the second part is talking about, the subsidy cliff. This is talking about people that incomes are a little on the high, on the, medium to higher spectrum, over 400%. They may still qualify for some assistance on the marketplace. Even though the enhanced subsidy should have expired at the end of 2022, the Inflation Reduction Act, this has continued to expand those extra subsidies that we are still seeing. Additionally, in those states, if you work in states that have a state-based exchange, you'll notice that there are still some like extra subsidies. For example, in California, their exchange is called Covered California. The residents that apply in that state, they get the federal subsidies and then they get an extra state subsidy. So just keep in mind that these subsidies and the eligibility criteria for Medicaid CHIP marketplace, it does sometimes vary on a state-to-state basis. So just always keep that in mind. Okay, now let's talk about eligibility for pregnant women. So pregnant women who are non-citizens. Okay, pregnant women who are non-citizens are actually eligible for CHIP. It's called perinatal. I misspelled that. Sorry. CHIP perinatal. So CHIP perinatal, this is a program. It's like a form of Medicaid. And actually, what it's covering, it's not covering the actual pregnant woman. They're giving it because she's carrying the baby. So it's actually technically covering the baby, and that's why they're giving them access to this kind of form of Medicaid. So as long as they have a lawfully present immigration status, they will be eligible for this CHIP perinatal. And actually, it is extended to undocumented women in Texas. I'm not sure about other states, but in Texas, the CHIP perinatal is extended to undocumented women and qualified immigrants. So what the CHIP perinatal covers is it covers like some basic prenatal visits, prescriptions, labor and delivery, and postpartum care. So if you know of a family that maybe they aren't citizens, or maybe the woman is not a citizen but she has immigration status, or maybe even she's undocumented, she could apply for the CHIP perinatal program. If their income is below 207% of the FPL, and she will most likely be eligible for the CHIP perinatal. So additionally, if she has legal immigration status, she could get a marketplace plan as well. However, most people opt in for the CHIP perinatal because look, it's going to cover the labor and delivery like at no cost. So a lot of the time we see people going to the CHIP perinatal, and then once they get kind of kicked off of the program, that's an SEP. Once they lose that CHIP perinatal, that's an SEP throughout the year for them to get onto a marketplace plan if they would like to get on a marketplace plan. But just note that this program is available to undocumented women in Texas. Not really sure about other states, but I can look into it if you guys have those questions ever. So this is a really good option for non-citizen women that are pregnant. If they don't want to pay for a marketplace plan or they can't afford it, or if they're undocumented, CHIP perinatal is a very good option. So this was pretty updated. This was updated at the end of 2023. So right now, CHIP perinatal coverage will end on the last day of the month that the birth occurs. I think during COVID, or there was a time that it was lasting like up to a year, but now I think I guess it's the last day of the month after the birth occurs. And it looks like they're giving the mother two postpartum visits um, until their CHIP ends. So again, once their CHIP ends, they would be eligible to apply for a marketplace plan, or they could get onto their family's marketplace plan because that is an SEP for the CHIP loss of coverage throughout the year. Okay, one thing I didn't add is that once the baby is born, I believe that CHIP or the Medicaid is extended to the child. So that's something that I didn't add in here, but that's just something to take note of. Um, if their income is low, I believe the baby would get CHIP or Medicaid. But if their income is higher, they might be able to get onto the marketplace later on once they lose that CHIP or Medicaid. So Megan had a good question in the chat. She messaged me directly and she said because it's not minimum essential coverage. So CHIP perinatal is not considered minimum essential coverage, but we have been successfully using someone losing that CHIP perinatal as a loss of coverage SEP, and we haven't had any issues with it so far. So just to note that yes, you're correct. It's not seen as minimum essential coverage, but we still have been able to use that SEP, and we haven't had any issues with it so far. They haven't asked for any documents or anything like that to use that SEP. Okay, so the last part I really wanted to highlight is going to be enrollment barriers for immigrants in the marketplace. So why will some immigrants try not to enroll? Or why are so many people so afraid to enroll into a marketplace plan or maybe apply for Medicaid or apply for CHIP for either them or their children? So the common reasons we see this perception is because they think that they might not even be eligible for help. Okay, there's lots of stuff in the media that is just so, anti-immigrants, especially when we saw, um, you know, President Trump in office. We noticed that there was just so much bad, I guess bad perception against immigrants. So a lot of them were scared of applying for anything. I believe at one point, I don't know the exact verbiage, but he was saying something about if they apply, they're going to get deported. And it was just terrible. It wasn't true. And it was like unlawful for them to do that. But a lot of people, they just have these perceptions that they're not able to apply for anything, that it's going to affect maybe their immigration status, their immigration case if they're going through one, if they apply for any type of help. Okay, but we're going to talk about the public charge and why that's actually not true. That these immigrants are eligible to apply for programs like Medicaid, CHIP, and Marketplace, and it's not going to have any effect on their immigration status, maybe renewing their immigration, deportation, or anything like that. So what is the public charge and who does it apply to? So the public charge is just a test or assessment um, that that is applied to two types of people, people applying for a visa to enter the US or people applying for a green card or permanent residence through a relative. So the public charge test assesses whether someone is likely to be dependent on public benefit programs in the future. So most people don't actually need to worry about the public charge. I think most of them are just not educated on what it actually is and who does it apply to. I think a lot of people may have heard about it on the news and then they talk to their friends and family and they're like, "Oh, you're not allowed to apply for all of this because it's going to affect you're trying to apply for a work permit or a green card, and if you apply for these programs, you're going to mess up that whole case." It's just common misconception, people not understanding what is actually going on. So it's important for you as an agent and broker to be able to explain this to people. Because I actually had an agent ask me in December during open enrollment, they had a client they wanted to enroll, and the client was like so fearful to give her any information because she didn't want to apply for the program because she didn't want it to mess with um, her immigration status, or she was trying to get move from a work permit to a green card, and that she thought it was going to affect her case. And I was like, that's not true at all. Like, tell her that it's going to be okay. And she was like, no, she needs to see actual documentation or needs to read something like an actual published letter that it's okay. And I was like, can't she just take your word for it? But people are genuinely scared to apply for these programs. So it's very important to understand and see where you can get these resources to share it with those clients that are very fearful. So it says additionally, most government programs don't count as public charge. So if Actually, these ones, the ones that are listed right here, financial assistance, SSI check, temporary assistance, these are going to be some of the items that are going to be considered public charge. Like if someone is applying for these and they're also, immigrants, these would count because it's talking about dependent on a public benefit program, like actually receiving cash assistance or money. But things like applying for Medicaid, CHIP, or marketplace coverage, it will not affect their immigration status. And that's just what we need to understand. So I kind of went through the public charge a little fast, but I really just wanted to go over that. And so what I will include in the email to y'all with this recording, again, I'm going to include the federal poverty level chart, but I will also include a couple of links to some news articles or actual, published resources that show you or prove that the public charge and, applying for these types of programs will not affect clients or prospects in any way, because I know a lot of people want to see the actual proof. They just don't believe it. Um, but this is actually the end of the presentation. Of course, I can kind of talk about this all day. This is kind of an unending topic. And, throughout things happening in the world, we see that there's, sometimes groups of people that are going to be let into the country, and, the Health and Human Services, they'll, publish a letter and say, people from this specific country, they can temporarily apply for Medicaid or CHIP because they're here on, refugee or asylum status. So when things like that happen, we like to let the agents know because, especially being in Houston, we get people from all over the place. So it's really important to be able to kind of help the community out and understand what's going on. So, just keep up to kind of what's going on in the industry, because it sometimes does trickle down to us and really does affect us on a day-to-day basis. Um, but that is the end of the presentation today, you all. Thank you so much for joining this training today. I hope you got some type of beneficial information out of it, and I hope the scenarios also helped you a little bit more. If you guys have any questions that you want to ask, I will let you guys unmute yourself in just a second. You can drop your extra questions in the chat box. And additionally, if you felt like this training was a little confusing to you and you want to get more down to a basic level, you can also reach out to me directly and I can schedule some other trainings for y'all. Also, in the near future, I'm going to be doing a health Sherpa training where I can also walk you through or show you what are the specific questions that you need to answer properly when you have a family that's either a mixed family. And a mixed family is going to be, they have mixed immigration status. So maybe we have a husband that's a US citizen and the wife has a green card or a work permit, or the kids have work permits. All of these types of things are considered mixed families. There are specific ways you need to process the application to get the right eligibility results. Um, or if you're not sure if the kids can get on Medicaid or CHIP and things like that, you can always reach out to me. I will